Another very important muscle of the neck that we treat here from the neck up is the scalenes muscle. There's a really great way to do self-massage to this area. And here is my assistant, Gustav, just to demonstrate where the scalenes muscle is. So we have the collarbone here. So just above the collarbone is where we see some of the scalenes muscles there. It attaches also at the transverse processes. So this is the area that we'll be massaging. So when we're using the technique, what we're going to do is we're going to compress a little bit and we're just going to go side to side. You could also do some downward motion this way, right in there. And so the best way to locate the scalenes is to look for this triangulation. I'm just going to lower this here, is to look for this triangulation in here. So it's in front of the trapezius muscle. This is a trapezius muscle right here. So it's in front of the trapezius muscle. And then next to it, we have the sternocleidomastoid. So we want to go in between those two tissues in this triangle. The way that I like to do self-massage to this area is by using liquid chalk. Liquid chalk allows me to just have a really nice firm pressure. If you prefer oil or lotion, then that is up to you. So I'm just going to use a little bit of this liquid chalk here, just a dime size amount. And because I like a drier technique, you could also use hand sanitizer or any type of baby powder. It just prevents any glide from happening because I want to have, again, a nice static pressure. So I'm going to take 2 or 3 fingers. I'm going to locate that triangulation in here. So right above the collarbone. And what I'm going to do is I'm just going to push in a little bit and then engage the tissues side to side. So I'm just above the collarbone and I'm pushing in a bit. Now I'm going to start engaging the tissue side to side, just making sure as well that my spine and my neck are nice and neutral. And I'm just going to start working my way up. Now we don't want this to hurt at all, just want to feel like we're engaging the tissues. And if you want, you can tilt your head a little bit to get more access there. Not a lot, just a wee bit of tilt. And here I am working back and forth. Feels like such an important muscle for me. And the lower part of the muscle here is really easy to access, exceptionally important when it comes to issues of the neck. If you are going to be using some oil, you might want to consider just kind of maybe like scooping down as well. Just like this. Again, we're just scooping midway here, all the way down to the collarbone or the clavicle. And nice and gentle there. Head is nice and neutral. And we're just doing a bit of self-massage there. When you're performing self-massage, you want to think about doing it every 4 days or so. We don't want to overstimulate the tissues. And remember, respect the injury, be patient with the process, but most of all, be gentle with yourself.